Good morning, afternoon, everyone. Thank you for joining me today. Our presentation is titled Ethically and Legally Sound Alternatives for End-of-Life Decision-Making. We will be exploring hospice and palliative care options that provide compassionate and thoughtful support for patients during this critical time. This is an important topic that touches on both the ethical and legal aspects of care, aiming to help patients and their families make informed, respectful decisions. I look forward to sharing valuable insights with you today. When we talk about end-of-life decision-making, it's really about honoring what patients want and ensuring they receive the best possible care in their final days. This process isn't just medical. It involves understanding the ethical principles that guide these decisions and knowing the legal frameworks that support them. We'll also explore how hospice and palliative care options play a crucial role in improving quality of life. Understanding these alternatives is vital because it helps us respect patient wishes and deliver compassionate, appropriate care. When caring for patients with terminal illness, managing pain and symptoms effectively is crucial. This not only helps relieve physical discomfort, but also significantly improves their overall quality of life. Equally important is providing emotional and social support, which addresses the psychological challenges these patients face, offering comfort and connection during difficult times. Finally, respect for a patient's dignity and preferences must guide all ethical and legal decisions, ensuring that care honors their autonomy and personal values. Together, these elements create a compassionate approach that truly meets the complex needs of terminally ill patients. Here we explore 4 key ethical principles that guide end-of-life care. First, autonomy emphasizes respecting patients' rights to make their own decisions about their care. It's essential to honor their wishes and ensure they feel empowered throughout the process. Next, beneficence focuses on promoting the patient's well-being by selecting treatments that provide comfort and relief, aiming to improve quality of life even as we manage serious illness. Non-maleficence reminds us to avoid causing harm by carefully weighing the risks of any interventions we consider. Lastly, justice is about ensuring fair access to hospice and palliative care for everyone, so that no individual is denied compassionate support. Together, these principles create a foundation for compassionate and ethical care at the end of life. When discussing end-of-life choices, it's important to understand the legal frameworks that support individual autonomy. First, we have advance directives. These are legal documents where a person clearly outlines their preferences for medical treatment in situations where they can no longer express their wishes themselves. This ensures that their healthcare aligns with their values even if they become incapacitated. Next, we have the healthcare proxy and power of attorney. This legal authorization allows someone trusted by the individual to make healthcare decisions on their behalf if they are unable to do so. It's a vital safeguard that ensures decisions are made in line with the person's desires, keeping their best interests at the forefront. Together, these frameworks create a structured approach to managing complex medical decisions, providing clarity and respect for personal choices during critical times. Here we're focusing on what hospice care really means. Hospice care is a specialized type of support given to patients who are expected to have 6 months or less to live. The main goal isn't to cure the illness, but to ensure comfort. This includes managing symptoms effectively to reduce pain and distress. Beyond physical care, hospice also offers emotional and psychosocial support, recognizing the importance of mental and emotional well-being during this time. Family involvement is a key part of the process, helping loved ones stay connected and supported as they navigate this difficult journey together. The image here of a child receiving a small backpack in a warm, home-like setting reminds us that hospice care is about creating a nurturing, compassionate environment. Here we have an overview of palliative care, which is specialized medical care aimed at relieving symptoms and enhancing the quality of life for patients facing serious illnesses. One important thing to understand is that palliative care is not exclusive to end-of-life situations. It can be provided at any stage of a serious illness and can be given alongside treatments that aim to cure the disease. The focus here is on comfort and support, addressing physical, emotional, and sometimes spiritual needs to help patients and their families navigate the challenges they face. The image on the right really captures this compassionate approach, showing a healthcare professional attentively monitoring a patient's vitals while another person takes notes, symbolizing the collaborative and personalized nature of this care. Here we have a clear comparison between hospice and palliative care, highlighting their key differences and similarities. Starting with eligibility, hospice care is typically for patients with a prognosis of 6 months or less, who are no longer pursuing curative treatment. In contrast, palliative care can be provided at any stage of illness, regardless of whether curative treatments are ongoing. The primary goal of hospice is to ensure comfort and quality of life at the end of life, while palliative care focuses on managing symptoms and improving quality of life, even alongside curative efforts. In terms of treatment compatibility, hospice does not support curative therapies, whereas palliative care can be integrated with treatments aimed at curing the illness. Regarding the care setting, hospice services are usually delivered at home, in hospice facilities, or nursing homes. Palliative care, on the other hand, is more flexible and can occur in hospitals, outpatient clinics, or at home. Finally, both involve a multidisciplinary team, including physicians, nurses, social workers, and chaplains. But palliative care teams may also include other specialists depending on patient needs. This comparison helps clarify which approach is appropriate based on a patient's condition and care goals. On this slide, we're looking at the key benefits hospice care offers to terminal patients. First, hospice care focuses on effective pain and symptom relief, which is crucial for improving a patient's comfort during this difficult time. Next, emotional and spiritual support is provided in a comprehensive way, tailored specifically to both the patient and their family's needs, helping them cope with the emotional challenges they face. Another important aspect is care coordination and respite. Hospice services coordinate various supports and give families much-needed breaks from caregiving, preventing burnout. Finally, improved family outcomes are a major benefit. Hospice enhances family involvement and supports better emotional experiences during the final months. Together, these elements highlight how hospice care is not just about managing illness, but also about providing compassionate, holistic support to patients and families. Here we see the significant benefits of palliative care in managing symptoms commonly experienced by patients with serious illnesses. The horizontal bar chart highlights the percentage improvements across 4 key symptoms. Pain management shows the highest improvement at 80%, which is crucial since pain can severely reduce quality of life. Breathlessness also sees a substantial improvement of 65%, helping patients breathe easier and feel more comfortable. Nausea and fatigue improve by 50% and 55% respectively, demonstrating that palliative care addresses both physical discomfort and overall energy levels. By effectively managing these symptoms, palliative care plays a vital role in enhancing patients' daily well-being and overall quality of life. Here, we're focusing on patient autonomy and the important role advance directives play in maintaining it. An advance directive is a legal document where you clearly outline your wishes for medical care in case you're ever unable to speak for yourself. It's crucial to note that this directive only comes into effect when a healthcare provider determines that you can't make decisions on your own. To ensure your preferences are respected, you should also appoint a trusted person as your healthcare proxy. This person will make medical decisions on your behalf, guided by your stated wishes. This process is all about preserving your autonomy, even when you're not in a position to communicate directly. The image of the street sign with arrows pointing to possible and impossible reminds us of the power an advance directive has to clarify what is possible in your care. Here we focus on the crucial role healthcare providers play in supporting decisions. First, communication is key. Providers work hard to ensure that both patients and their families clearly understand the information, which helps foster shared decision-making. This collaborative approach ensures that everyone is involved and aligned with the care plan. Secondly, providers also take responsibility for thorough documentation. They carefully record all decisions to uphold legal and ethical standards. Additionally, they coordinate closely with legal tools and family members to back these decisions, ensuring that everything is properly supported and respected. Together, these efforts create a foundation of trust, clarity, and protection in the decision-making process. Palliative care can be provided at any stage of an illness to help improve a patient's overall well-being and manage symptoms. Finally, some believe that choosing comfort care shortens life, but comfort care can actually enhance quality of life and, in some cases, even extend longevity. Understanding these points helps us better support patients and families during challenging times. Here we have two important case studies that highlight the benefits of hospice and palliative care. First, in the case of hospice at home, a terminal patient was able to receive care in the comfort of their own environment. This not only helped manage their symptoms effectively, but also increased their overall comfort. Additionally, the care team supported the family comprehensively, which made the end-of-life experience more positive for everyone involved. The second case study focuses on early palliative intervention. A patient who received palliative care alongside their ongoing treatment experienced better symptom management. This approach also brought greater clarity to medical decisions and ensured that the care provided was closely aligned with the patient's goals. Both cases underscore how integrating hospice and palliative care can significantly enhance quality of life and decision-making during challenging times. When supporting a loved one facing end-of-life decisions, it's crucial to really listen to their wishes and respect their autonomy. This means honoring what they want and need, rather than making assumptions or imposing our own preferences. At the same time, providing steady emotional support helps them feel understood and less alone during such a difficult time. Alongside this, offering practical assistance, whether it's helping coordinate care or managing day-to-day tasks, ensures their comfort and dignity. Together, these efforts empower the individual, giving them control and peace in their choices, while reinforcing the deep connection and care families can share. Here, we summarize the key ethical and legal considerations essential to quality care. First, ethics form the foundation, emphasizing autonomy, beneficence, and non-maleficence. These principles ensure that we provide compassionate care while respecting each patient's rights. Next, legal tools play a crucial role in clarifying decisions with advanced directives, DNR orders, and healthcare proxies, giving both patients and providers a clear framework to follow. Finally, clinical practice integrates all these elements through effective communication, thorough documentation, and a multidisciplinary approach, ensuring that care is implemented properly and consistently. Together, these factors create a comprehensive approach to responsible and respectful healthcare. As we wrap up, let's focus on the key takeaways that are essential in providing compassionate and effective care. First, respecting autonomy is paramount. It's about honoring and supporting patient wishes throughout every care decision. Next, early legal planning ensures that advanced directives and necessary legal tools are in place promptly, which helps guide care when patients might not be able to express their preferences. Palliative support plays a critical role by providing symptom relief at every stage of illness, improving quality of life. Finally, offering hospice care at the right time, when it truly aligns with patient needs and goals, ensures comfort and dignity in the final phases. Together, these principles guide us toward delivering patient-centered, comprehensive care.